So it's been a while since I posted a video. So I thought I would make a video how I'm doing and explaining a little bit why it took so long. So before I went to Georgia, I had allergy symptoms like coughing and a little bit itchy in my throat. And I thought, well, maybe it's hay fever because sometimes I have hay fever. So then I went to Georgia and I went into the plane. And the day after, when we were in Georgia, I had a very sore throat. And that went on and off for like 3 to 4 days. And then I started developing a severely nasty cough. So at first it was not too bad. I was just coughing a little bit. But when I went back in the plane again, and I was back in the Netherlands, the coughing got so severe that I could not sleep. I had to sleep upright. I had like throwing up all the time, and I could not speak like this without coughing. So it was not really possible to make any videos. So at first I thought, well, maybe it's like whooping cough. They're still not completely sure if I have that or not. But they say, well, at least you had like multiple viral infections, one after the other. So yeah, I'm getting a little bit better these last few days. A little bit less coughing. Maybe I will cough a little in this video. I don't know, but yeah, it's been way less. I got some sleep. Now I'm sleeping almost through the night again, so that's good. So yeah, that was the reason why I did not post any updates and any videos so far. So what has happened since then? So I posted a video about going to the EMC. I went there April 23, and yeah, they took swabs. They put them on dry ice again, as you could see in the video. And they are going to review them later, because they're going to review them everything. They will take every swab in one time with microbiology to see what the phages are doing to my HS, to my skin flora, and to my intestinal flora. And I'm still doing their diaries, which is pretty handy because then I can completely see myself what the phages are doing through my pain levels, with my drainage and with my inflammations, which is pretty interesting. So I took phages for 19 days. Normally it's 20 days, but because I was coughing so much and I was throwing up the phages over and over again, which is no use because when you throw them up, they do not work. And because of that, I stopped a day early. Normally it's 20 days of phages, and then 2 weeks of stopping or less if you have if your inflammations get worse again. So the first week was fine. Yeah, I was coughing and I was really ill and had a lot of stress because of being ill and not sleeping. So that was not nice. But my inflammations were okay. But then in the second week, I got more stressed because the lack of sleep. I was in the week before I had to have my period, which is normally also a trigger, just like stress. And so as I was saying before I started to cough, this is why my face is so red now. Normally my triggers are stress, which I was having a lot because of being ill and not sleeping enough. My period, so in the week before my period is hell. And I can really feel in my body that my period is coming, and I'm getting loads of inflammations. Inflammations that are already there, they really get severe. Plus, because of the coughing, I couldn't hold my urine anymore because the coughing was that severe. And I have to wear like the pads, and that is like scraping against my labia. So those 3 are my main triggers. So then I had to stop the phages because I was throwing them up, and I had to stop them anyway because normally you take them for 20 days and then you're 2 weeks off. I had to stop the phages, and the first week that was fine. But in the second week, I started to get this really big inflammation on my labia, where the pad was scraping. And again, the hormones and the stress did not help as well. But because I was still throwing up, I could not start the phages yet. So I had contact with the Eliava and asked them what should I do. At first they say, well, maybe lay off the phages for a while because you're coughing so much. And I said, well, my inflammations got worse, or I got a new one, which is pretty severe. they said, okay, then as soon as you stop throwing up for a few days, start as soon as you can, because it's important that we get the inflammation under control again. So this is my fridge. Let me show you guys what it's like to have bacteriophage treatment in your house. So this is my drawer. It's filled up all the way to the back with all the bacteriophages that I use. So here I have some swabs. I have to send them in a few weeks, and then they will check again how it goes with my bacteria. Then what else? Then I have, of course, the bacteriophage cream. This is the Intesti cream. And I have boxes with the staphylococcal cream. I have the suppositories, so the set pills, they're in there. These are the staphylococcal set pills. I just did a run of the Intesti set pills, and I just started today again with the phages, like I told. And I have to take the set pills. So these are like the little bottles. So this is almost empty, but let me show you guys. So these are the intestiphages. And there, they're like an amber color, the fluid. And this is the staphylococcal phages, the oral version, and they are clear. As you can see, they are clear. So now for the second term, I have to take the intestiphages twice, and the staphylococcal phages, I have to take them once a day. So I started today. This is my first day. And now I have to take, before I took the intestiphages in the morning and the staphylococcal phages in the evening. In between, I did 2 or 3 times of the Intesti cream. And at the night, I took the intestiphage suppository, so the Z pills. So now it's a little bit different. Now I have to take the intestiphages orally in the morning and in the evening. And in between, in the afternoon, I have to take the staphylococcal phages orally. At night, I have to take the suppository set pills, but they're not the intestiphages anymore, but the staphylococcal phages in set pills, so suppositories. And the creams, I can alternate between the intestiphage cream and the staphylococcal phage cream. So I can alternate and see which cream works better on which spots, and yeah, really make a personal approach on my body. So I started it today. So I already took my morning phage and my afternoon phage. Right before dinner, I will take my my evening phage, and then when I go to sleep, I take my suppository, and I'm using the creams. So we will see what it does. I will take pictures. I started taking pictures yesterday to show everybody the before and the after, and what the phages are doing to this specific spot. And well, it should be really interesting to see how fast the phages will get this spot under control. And I will try to share it with you guys, maybe the pictures in the next video. On the end of this video, I will show you one of my spots who has been returning over and over again. It's a spot in my inner left groin. And this was a spot that was there for months. Literally months. I think I had it since November or something. And what it does, it comes up like a blister kind of thing. It opens up, it drains, mainly blood, sometimes a little pus, but mainly blood. And then it goes down again, and then it's almost gone. And you think, okay, maybe it's gone this time. But then the blister starts getting really thick again. It inflammates again. It opens up again, it drains again. And that's a never-ending story. So this spot, it disappeared within 4 days after when I was taking the first cycle of phages. So I will show you how it was before, different times that I took pictures of it. And I will show you a picture of one day before. It was just starting to inflammate again. A picture, I think 3 days into treatment, and a picture 5 days into treatment, or 2 weeks, sorry, 2 weeks into treatment, and then you will see it's almost gone. And it's still gone. It didn't inflammate again, not even with the stress or the triggers. It's still completely gone. And again, this was there for months. Nothing worked. I was on heavy antibiotics. I was on fusidine cream, resorcinol cream. Nothing worked. So as soon as I started to take the Phage cream and the Phage orals, 5 days. That's all it took. So that's pretty amazing. So yeah, as you can see in the pictures, it's really, really, really a big difference. So yeah, well, I will keep you guys updated what it does with this new spot. And I'm interested to see what this new cycle of phages will bring, because now I'm taking more phages than I did before. And yeah, should be interesting to see. So thank you so much for following my story and my documentary about hidradenitis suppurativa and my bacteriophage treatment. And again, I hope this will inspire many people to seek this treatment as well, because I think it can help a lot of HS patients. It's not cheap, but some people have to start with it, because when it's working with a lot of people, then there will be more studies, and then it will be available in many countries in a few years. And this is something that I would like to do. So far, no side effects whatsoever. So the coughing was really not a side effect of the phages. We know that now. And the clinic already told me that, but now I'm pretty sure it wasn't, because when I stopped the phages, the coughing actually got worse, and maybe the phages even took away some of the bacteria that were there. And after I stopped the phages, I started to cough up like pus and stuff. So it actually helped my coughing, and it did not make it any severe or any worse. So we know that now. It's really not a side effect. It was really something that was already there, and actually maybe helped a little with it. So and other than that, I have no rashes. I'm not more tired. I actually have more energy, even though I just had this really big coughing episodes. I have way more energy. It's pretty interesting. And it does nothing bad to your body. So this is why this is such an interesting approach for HS. So thank you so much for watching my videos. If you have any questions, drop them below in the comments. If you have any topics you want me to discuss on HS or on bacteriophages, let me know and I will try to make a video about it. So for now, this was this episode. I wish everybody a lovely day, and see you guys soon in the next episode. Bye everyone!